Hi there, my name is Julie, and I am getting surgery in about 24 hours for back fusion. I'm having an ALIF at L4-5, and then they're going to flip me over and do bilateral laminectomy and a posterior fixation with screws and rods, along with uh, uh, posterior fusion. So oh boy, that's a lot to do. I'm beyond ready for surgery at this point. It's been 3 months. I think 3 months since we have known that I'm gonna need surgery, and 2 months since it was scheduled. Um, One of the disadvantages to trying to, to knowing knowing that you need surgery at the end of a year is just how crazy busy that surgeons' schedules and just hospitals and doctor schedules get at the end of any calendar year. Just everybody's trying to get in and get their stuff done to meet their deductible and save some money. So I understand that. We were trying to do the same thing. So, but I am so ready. I was able to work up until about middle of the week last week. I had uh, you know about they tell you 7 days. I think it's 7 days prior to surgery. You're supposed to stop like a lot of your pain meds. So I've been taking Advil. I've been taking about um, how many have I taken? 1,600 milligrams a day of Advil to kind of get through my day. And I was also taking the occasional uh, uh, medicinal kind of stuff to help me out. And I've since stopped that. And yeah, anything that I could possibly use outside of, say, ice and Tylenol, which Tylenol doesn't help me a whole lot. Maybe it takes the edge off. It's hard to say. But so I've been off of that for a bit. And I got to say that this week my back pain has been a lot worse than it was. With the pain medication, I was still kind of doing a fairly physical job. But last week I went to half days at my job, and on Thursday, I was like, I'd struggled all week, and I was just like, I can barely lift things. I can barely straighten up and do stuff. And I'm like, I just need to stop. On Thursday, I was like, I can't come in Friday. So they were cool about that. Um, but this, for the past 5 or 6 days, like I said, my back has been very uncomfortable. It's been difficult to sleep, difficult to find a comfortable position. I'm leaning back in my chair right now, which is actually not the best thing for my back because it's going to hurt a lot when I go to get up. But honestly, kind of leaning back does provide some relief, as does some icing will as well. But I've not gotten a lot of sleep. So if you're somebody who wants to work right up to the last day of surgery because you're like, I got to get everything done, which is kind of what I felt. I'm going to get everything done that I can right up to the day before surgery. And to be perfectly honest with you, that at least for me, that just has not been possible. I need to just get through the next 24 hours and then I'm set. But, there's just not a lot of sleep. I've gotten, I think two nights ago, I got like 10 hours of sleep. But like last night, I got about 4 or 5 hours. The night before, I got no sleep. Even napping is hard. At the most, I can get maybe 90 minutes of sleep. But it's 4:30 in the morning right now, and I woke up an hour ago because I'm just uncomfortable, and everything's uncomfortable. So uh, one thing that I would tell you that if you are that I need to do after I finish this video, but need to do some stretching. If I can stretch my hamstrings, kind of try and stretch my lower back as much as I'm able to, that does alleviate things for a little while. And whenever the back pain does get kind of bad, I know that that's kind of what I need to be doing, because I'm just, my hips, I can feel the muscles all around my hips are just super tight right now. I think my body's just trying to hold everything in place. So, there are a couple things that they have given me that I've been using for the last handful of days or so. The first one is an antibiotic called mupirocin. Comes in a little tube like this. And this is basically to kind of prevent bringing nasty bacteria infections into the hospital. And because it's not like it goes in your nose, believe it or not. So you take what do you call it? I take a Q-tip, and I put about they tell you a pea size. It's like a Tic Tac, half of a Tic Tac pea size, dollop on there, and then I put it like just on the inside of my nostril, and I kind of roll it around, and then I'll let that sit for at least a minute, and then I kind of wipe out anything that, do it on both sides. I wipe out like anything that's excess, and I do try to kind of wipe that off a little bit, because I found that I sneeze a little bit if I don't. But that's twice a day, up till the time that you go into the hospital. So that's something that I've been doing. And then the second thing that we picked up, that they had us pick up, was the HiPAA. And if you've ever had surgery, you know what this is all about. And I've had several surgeries before this one. So this is a 4% chlorhexidine solution, which is a really strong antiseptic. It's a, almost, a lot of, betadine or povidone, iodine, the orange stuff, which I've had here at home for other reasons. This stuff is what they use a lot of times when you're when they're actually doing the surgery. They'll prep you with a scrub solution and get your make sure all your skin around your incisional area is good. But this stuff also stains, so you don't want to use this prior to surgery. So don't think that you can do that. That would not be good. But the chlorhexidine is nice. It kind of foams pretty well. Having this kind of application is really, really nice as well. So what you end up doing is you basically, they want you to do your incision area, soak that up good, and let that sit for like a solid minute, if not a little bit more. And I'm going to have 2 incisions. So I'm going to have the one in my lower abdomen, and then I'm going to have one on my back. And so how I manage that in the shower is that I'll get in the shower, and I'll go ahead and I'll wash my hair, and I'll rinse all that off. And then I actually go ahead and use my own soap, just to kind of clean, and just clean the private parts, the fronts and the backs, because you're not going to clean those with the chlorhexidine. You're going to leave those alone. So I'll just kind of do that, maybe pre-do my feet and whatnot. But then what I do is I actually will turn the shower off, and I'll try not to hold on to this, because I like, it's got the pump, so I have a little shower shelf, so I just kind of try to push down and use one hand. And I start with the incisional areas. I start rubbing in the area for the front, and then I'll rub in the area in the back, and then I'll begin to do the rest of my body. So I'll just start with like my neck area, and I'll just work my way down, ignoring the, like I said, the private, the general areas, and go all the way down and get my feet. And I find that about the time that I do that, if I'm kind of just very deliberate and careful, I probably stand around for like another 20 seconds or so, and then that's long enough basically to then say, okay, that was on long enough, and I will then turn the shower back on, and then rinse myself off. Take a clean towel, kind of pat myself dry all over, and then put on clean PJs or a clean t-shirt or whatever I need to do. Not wearing the same, kind of used to wearing the same sweats all the time, but I'm trying to wash things and keep them clean, just so that I'm keeping as much bacteria off my body as possible, again, so I don't bring anything in with me, so that I can decrease the risk of infection at the surgical site as much as possible. So sites as much as possible. So yeah, and then I have to, tomorrow morning, I'm going to have to do these procedures again. The HiPAA is just once a day. So I will, I might shower tonight. I'll probably shower first thing in the morning. So I probably won't worry about showering tonight, because I'm not going to do anything today other than like cleaning and packing a bag and all that other stuff. So, there's that. We have to be at the hospital 2 hours prior to the surgery, and my surgery is scheduled for 9, so we need to be there by 7. We'll probably be there at 6:30, because my husband always likes to be really early, which is great, because I just don't want to have to worry about parking, and just, although he's going to drop me off at the entrance, and all that. So I will, we'll be there in plenty of time. We had a phone call with a nurse from the hospital, just going over a lot of the procedures for the cleaning and the ointment, and just kind of what to do, what not to do prior to surgery. And that was great. What we did to make sure we were ready was we actually wrote out a list of questions that we wanted to make sure that we had answered, and she pretty much answered everything before we needed to ask any questions. But it's important, I think, to kind of just sort of sit down and calm down and kind of clear your head and just think, okay, what do I need? What do I need to do? What do I need to know before I go in? How do I set myself up for the best possible surgery and post-op recovery and everything? So there was that. So we did that. That was, like I said, that was, it's like 20 minutes, no big deal. One of the things that she told me that I was a little surprised about, I've had neck fusion. I have a neck fusion here, and then I had another one here that you really can't see as well. This one was done by an orthopedic spine surgeon. This one's done by the neurosurgeon, so you can see which one was a little bit more careful about things. But in the past, you fast prior to surgery. Typically, you fast after midnight the night before. So no food, obviously, of any kind. There is some lightening of restrictions in terms of water, but they do want you to minimize that. But here's the thing about that is that she said, because my surgery is longer, which it's going to be at least 3 hours, could be 3 to 4, maybe a little bit more depending upon just my particular circumstances. And so because of that, I was actually told 4 hours prior to my surgery time. So at 9 o'clock is my surgery time. So at 5 o'clock, I need to drink 10 to 12 ounces of a clear, sugary drink. And we picked apple juice for that. And I was a little surprised, but then she said, the key with that is just keeping your glucose levels up. You're going to be in surgery for a while. Your body's going to be very stressed. And this just gives your body like more immediate sugar reserves, so that it kind of protects itself. So I think that helps a lot in waking up better from anesthesia. And that initial post-op phase, like you don't want to be, your body doesn't want to be stressed out because it needs sugar, and so there's that. So we got some of that, and I'm going to do that in the morning. I highly doubt I'm going to get very much sleep at all tonight. I just don't see that coming. Maybe I'll be lucky and do that, but at this point, if I get tired enough during the day that I feel like I need to take a nap, I just take a nap, because I've, like I said, I don't sleep well at night now, so just sleep when I can. I have slept in a recliner a little bit, and it does help a little bit, but like I said, stretching helps, icing helps. But so yeah, I'll be in the hospital for a couple of days, couple of nights, I should say, for Valentine's Day. Woohoo! And my husband will be with me, and yeah, I feel like I'm as prepared as I can be for something like this. I've practiced my log rolls. I've practiced getting in and out of the car. Log rolls to get out of bed, getting in and out of the car. I got myself my grabber, which, for the first 6 to 8 weeks, you can't. These things are amazing. For the first 6 to 8 weeks, you're not going to be able to twist or bend down. And I can actually pick a sunflower seed off the ground with this. That is crazy. So I'm going to keep this around for afterwards for sure. It's going to come in super handy. So I just got this off of Amazon. I can just put a link down. I think I can put a link. I don't know if I can put a link or not, but I probably can't. So there's that. Like I said, I think we're about as prepared as we can be. Let me turn myself to this way. There's a woman who's coming by today, midday or so, and she's bringing me my back brace. It is going to be a hard plastic, like in the back. I think it's going to be a hard plastic back brace. I should actually show you guys once I get that. But so I'm going to be wearing that after surgery, like anytime I'm out of bed. I have to have that on for I think the first 6 to 8 weeks or so, just to protect myself against self-induced injury, stupidity, twisting and bending and all that other stuff, because you might forget and do something really quick. So there's that. But yeah, so I don't know if I'll take any Tylenol today. I'm kind of staying away from pain medication, just because the theory is that if you don't take pain medication up to the point of your surgery, that when you do start to experience pain and they give you painkillers, your painkiller receptors are like super, they call it super potentiated, which is just basically they're like, give me the good stuff. And so yeah, we'll see. A lot of videos that I've seen, it's like some people come home from surgery and they take the good stuff for like, a day or two, and then they're like, woohoo, I feel great, blah blah blah. And then the other people are like, yeah, that was the worst experience of my life for the first week or two. Everybody is different, and so you just don't know how you're going to be. And I think that for a large amount of it is obviously the extent of the surgery that you're having. For me, my and I have another video on the channel that goes over my imaging. There is like hardly any disc between the L4, L5. I mean, it's very, very tiny there. So, and there's a lot of lipping, there's a lot of extra bone that has kind of grown over the edges. And some of that's going to have to get trimmed back, and they're going to have to sort of stretch, open my my disc space up a lot. And I mean, this has been a chronic, like, I've had this for years. So I don't know how my back muscles are going to be feeling about that afterwards, if they're going to just, react with lots of spasms. I don't know. I have always been a bit flexible. My hips are very flexible, and my lower back has been somewhat flexible outside of just, the pain from the back problem. But they're going to need to go in and basically open up that space. And then because there's all this extra bone that's sort of been healing all in this area, trying to solidify this location, one of the things that they've got to do is before they put the cage in with the cadaver bone to create the site for fusion, he's going to have to go in and actually drill holes up into my vertebra on both sides. So that's going to be fun, but thankfully I should be asleep for that. But he's got to drill holes up to get some blood flow down into that area to allow blood and a variety of different clotting factors and everything that you're going to need to get that area to fuse. It starts with having a good blood supply to that area. So I don't know how many incisions, or I don't know how many like holes he needs to make, but I'm like, make as many as you got to, because let's get this done. Let's get this done proper. So so we're gonna do that. But I think that for me, the sciatica, the nerve pain, is the thing that has been very uncomfortable until recently with the back pain. And that has faded somewhat. And I'm a little concerned about that because I do have a background in medicine. I was a veterinarian for over 20 years, so I do have an understanding of a variety of things. But in your nerves, basically, there are sort of like 4 levels of nerve injury, rough levels of nerve injury. The first one is like when your nerve is just the very top layer, your nerve is affected, it's pain. So pressure, any kind of pressure on your nerve will cause you to have a fair bit of pain, and that pain can be sent down through your like the whole length of your nerve and back up. And so, but you can have either pain receptors, and the stuff that like causes pain can pop out anywhere along that nerve. And for me, it started with the most distal, the most furthest away, like my toes, my feet, my heels. So it started there, and then I've had more pain in my my calves, my ankles, and recently I've had more hip pain on the left side. So it's just kind of all over, but that pain has subsided somewhat. It still hurts. The heel still hurts, but the second level of nerve damage is losing the ability to feel kind of like, is your foot in the right place? Can you control things the way that you need to control them? Not that you have strength per se, but just that you can put your foot where you need to put your foot. And I lost that a couple of months ago in my right foot, where I just can't really pick my my foot up very much. And then the third level is basically like loss of motor control, which it would be like a strength thing for people. It's the third level is like where you start to show weakness in your legs, and I've had that for the last couple of months. My left leg is just starting to get affected, but my right leg is definitely decreased. I haven't measured or whatnot. I really feel like I've lost muscle mass in my legs. Despite being very active, despite being walking around a lot at work, I had built up some strong muscles, but I think I've lost a lot of muscle mass. It just feels like it in my legs. But we'll see. And the worst phase would be when you can't feel anything. So that's what people think of, when they're paralyzed, or when they're truly like nerves are cut and whatnot. So I haven't, I'm not at that point. Thankfully. So the other thing that I've had that has been interesting is the swelling, especially in my right foot and ankle, primarily just along the front side of it, where the nerve travels all the way down. What I've read is that when there's enough pressure on that site, or any nerve basically, you will start to, over time, you'll start to get some nerve cell damage, and you'll start to see some fluid leak out from that area. And because it's, the damage is happening like in your leg and your hip and down your leg, everything gravity kind of just lets the fluid kind of settle down at the bottom. And my feet are, my right foot is definitely a little bit swollen. And something that people don't tell you about is, if you have that, and I have shoes that are very comfortable, that are super wide and have, were not tight on me at all. But as my foot started swelling more, I started having more foot swelling, but then I started having like ingrown toenails, which I rarely have ever had. And on my right foot especially, I've had like 3 different toes try to have ingrown toenails. So I've been treating those, or I treated those like a week or 2 ago. And just keeping your nails trimmed properly is important. And they do recommend kind of trimming them straight across as much as you can. But I don't know if that helps a whole lot, to be honest with you, because to me, if you have like little hooks on the end, you're going to catch your sock and all kinds of other things. And so, but that's something that I didn't expect to happen. So that was another reason why I kind of stopped working, is my feet just hurt so much, and I could feel my toes kind of crunching into the front of my shoes, and there wasn't any shoes that were comfortable. I would have had to buy another pair that was like a size too big in order to do that, and I'm like, I'm not going to do that just for the lead up here. So I just had to kind of deal with that. So but I'm looking forward to the swelling going away pretty quickly. Well, it may not go away pretty quickly, because the nerve regeneration, the nerve healing, is going to take a bit of time. I mean, nerves can regenerate roughly at about a millimeter. I want to say a millimeter a week. Correct me if I'm wrong. I think it's a millimeter a week. So a concern that I've had with my sciatic pain has been, because it went from like, there was a lot of pain for a while, and then it kind of went numb, and now I'm kind of weak, is like, how much damage do I have in those nerves, and how long is it going to take those nerves to heal? It could take months. And I think that might be other than just how much work you had done in your back, I think the nerve pain, the nerves kind of getting that pressure released from it, is the second thing that influences how much pain you have after surgery. The foot pain as it is, when your foot or anything falls asleep and then it starts to wake up and it tingles, and you know how uncomfortable that can be, really uncomfortable in cases. And I think that is a lot of what's going to cause pain when I come out of surgery, because it's a lot of what like the worst pain has been that, like my foot feeling like it's trying to wake up. And so there's not a lot that can be done for that. I mean, the heavy drugs can do that, and sometimes it's just kind of, getting through it. So we'll find out. I'll find out how it is. I really don't know how it's going to happen. I am anticipating waking up from surgery being in a lot of pain, and then having that mitigated somewhat, but still dealing with that, for the first couple of weeks. I've watched videos of folks who have been in a lot of pain, and I think that, to me, the one thing that I feel like the difference between some people, not everybody, that are doing really well after surgery, that haven't felt a lot of pain, and the ones that do feel a lot of pain and continue to feel a lot of pain, um, getting up and walking is going to be crucial to really getting past that painful part. And you get up and it hurts like the dickens and it's really uncomfortable. Like you just give me more pain meds and knock me out kind of thing. But you just have to get up and move. The more you move, the more your body will heal itself. And so my plan is to basically just walk as much as I can tolerate, and then go back to bed and hopefully sleep a little bit, and feel be able to repeat that over and over and over again. We'll see. We'll see. Don't know what's going to happen. So it's just everybody's different. So, and then you can't take ibuprofen after surgery for 6 to 8 weeks. It stunts it lowers the body's ability to clot and fuse. So we can't do that. I don't know if my medicinal stuff will be useful, if I'll be able to use that. Now, I could theoretically still be using that. My surgeon said that he didn't have a problem with me doing that, but the hospital recommended that I stop it. And I just microdose, so it's not like I take a lot, but if I can do some of that afterwards, that I think that would help a lot too. And again, not mega dose, but just something to take the edge off would be good. For me, that difference is just mentally feeling like, all right, I'm kind of with it. But speaking of mentally and being with it, not being with it, that's the one thing that my husband's going to control all of the messaging for at least the first 24 hours. He's going to have my phone, and the other thing I'm doing is I've removed the Amazon app, the Walmart app, the the banking app, anything where I could do something that would be not good. Yeah, we're removing that. I might even remove the Gmail app, the email app, all that, because I know when I had my neck surgery, or I had my second neck surgery, apparently I texted people right afterwards and it didn't make a whole lot of sense, and I don't even remember doing that. So I just don't want to go down that path. So I've got my husband to take care of me, thankfully. Obviously, it's hard if you're by yourself, but I would say if you're doing this largely by yourself, hopefully you have somebody to come and sit with you, and maybe sometimes, but at least take you home. But take those apps off your phone that you don't want yourself doing something stupid, like in the middle of the night and whatnot. So, or even in the middle of the day. But yeah, so we'll see. I'm gonna take some headphones in. I'm gonna take my tablet in with me. We'll see how much, if I get any use out of it. I plan to basically probably be sitting there at night playing on my tablet, because again, I remember from my neck surgery, not sleeping really well after anesthesia. That's one of those things that I like. After anesthesia, I can't. I mean, I'll sleep initially, but then I barely sleep the night after surgery. So if I bring some tablet, got a lot of games loaded on the tablet, and some videos and some different things. So I'll have some headphones, just to kind of block out stuff, and I'll probably just keep my headphones in my ears all night long and let it just kind of keep myself hopefully in a better place. So that's the goal. That's the start. I'm taking my shoes that I don't need to lace up. I'm taking a loose pair of sweats that I can just tie up. I'm going to take a kind of an oversized sweater top and some t-shirts and a little bit of underwear, and then just like deodorant, toothpaste, toothbrush, that kind of thing. So but I don't need a whole lot with me, and thankfully my husband will be there, and we only live about 10 minutes from the hospital, so if I forget something and I need something, he can come get me. My goal is to do well. My goal is to do everything that they tell me to do, and to walk as much as possible. But it'd be great if I could be home on Thursday. like I said, I'm not going to like staying in the hospital, I don't think. So I'm hoping that I will be able to just stay in 2 nights and be able to go home rather than 3 nights that I was told it might happen. So I think it depends on your pain level and how well you're up and moving around. So uh, yeah, I think that's it. It's a long video. Um, I don't know if I'm going to show anything else prior to surgery. Um, I would also recommend that you do all of your pre-registration prior to going to the hospital. They sent me multiple text messages and emails and whatnot, and so I went in. It seems like there's like 3 or 4 different places you need to register. So I just went in, and just registered. I also have a living will. I think that's really important. And so a living will basically it's like a medical attorney kind of thing. So it allows them to know your wishes as far as, like, I mean, say the worst happens and you're, something happens to you and you're, maybe you have a stroke or something crazy happens during surgery, and it's very rare, but it could happen. You would like to have something in place to let people know, like, these are my wishes, like, if all the different things, like, these are just my general wishes. I don't want this and I don't want that. And what I basically did was I just go through your state to find a living will, or a, let me pause for a second, I'll show you my stuff. Okay, so basically I just did this living will, medical durable power of attorney. And like I said, you can get these forms online. A lot of times you can get them for free. I did a trial with LegalZoom, and went on there, and they allowed you to kind of do 3 documents, and they walk you through kind of the questions to answer and whatnot. And so I went that way, and I got the living will. It says living will and medical durable power of attorney. So it's giving my husband the ability to kind of say, give somebody a say-so over your medical care when you're incapacitated. So, and then the other thing I'm doing is a durable power of attorney, which is more for financial things, to let my husband make decisions for me when I am incapacitated. And that includes, like, the first week or so after surgery, the day of surgery. You just never know what could happen. And then also, afterwards. And so I have some assets that he and I are not jointly partners in. So I just want to make sure that everything goes smooth. And it's not being morbid. It's just basically being prepared. And it's not a big deal. It really isn't. And like I said, going through LegalZoom was super easy. They have they go through, they make sure that you're getting the proper documents for your state. And it's really not a big deal. The living will is just life prolonging procedures, such as receiving nutrition and hydration. So, do you want an IV? Would you want a feeding tube? Do you want a respirator? All these different things. And then, donate organs, and what organs do you want to donate? And so just different things like that. And it's just basically just lining the person up who's going to be helping you out. You're just putting that person, letting everybody know that that person's in charge. Now, the living will you can just do as witnesses. So my husband and I signed this, and I'm going to give a copy to the hospital. So I'll take a copy into the hospital, and they can have that on file for now and in the future. So, and a notary does need to sign the durable power of attorney. So I could do that via, you can do that like online. You can actually get notary public online. You can also usually go through your bank and get that as well. So kind of waited to the last second on that one. Yeah, I think that's it, guys. So the next time you see me, I think, will be after surgery. So I hope to be able to do a little bit of something in the hospital. I think that I've really found comfort and also education in seeing what people are like when they first come out of anesthesia, when they first get up and walk. Because you're up and walking within a couple of hours of waking up. So I'm looking forward to. I'm not really looking forward to it. I'm looking forward to getting past this. I want it done so that I can move past it and get back to my life, basically. So pain-free life. So, all right, guys. If you're about ready to have your surgery, have faith, stay strong. Um, you know, have faith in your medical team. I think that, you know, that's about all you can do. Be honest with you and just have faith that it's going to, you know, you're going to come out of this better than you went in. And hopefully it'll give you your life back, or at least enough of your life back that it greatly increases your quality of life. And, you know, I'm hoping for a lot. I'm planning for a lot. So, all right, guys, I'll see you soon.